Welcome, everybody. I'm Karen Iverson. I'm a practice transformation coach with Alliance Chicago. And today we're going to talk about pioneering the PRAPARE form in Centricity. So for all the GE users out there, this is a form that you would be able to see in your environment. Just a few quick words about who Alliance Chicago is. We were founded in the late 90s. And now we include over 49 safety net health centers, federally qualified community health centers, nurse-run managed locations, and free clinics across the nation. Your eyes don't deceive you. We do have sites in Alaska and Hawaii as well. So come on out with me and do some PRAPARE training on the form to those great places. So we are across 19 states. You can see over 1 million patients that are served to date, many partners, funders. We have over 50 employees and a lot of research affiliates that we work with. We wanted to talk to you about the PRAPARE form today. And some of the data which needs to be gathered in the PRAPARE form, if you use the GE Centricity product, you will use the patient tab on the practice management side of the screen. So you will see the name, the birth date, pullover, as well as race and ethnicity, which is down here on the lower right-hand side. Preferred language is also in there as well. The address is a part of the PRAPARE form too, which is over here on the left-hand side. So if you're using GE Centricity, you're going to look on the practice management tab to get some of those demographic fields. If you are a federally qualified community health center and you're on Centricity, chances are you are using the Visualution plugins or third-party plugins that sit on top of the patient tab in practice management. In the CHC registration tab, there's a number of items that the PRAPARE form pulls in order for that form to work. So we've talked about race, ethnicity, language, and address, but there's a few other items as well. There's family income, number of people in the household or family size, as well as any veteran status questions and migrant work information. Those are going to be found in the tabs on the right-hand side of the CHC patient registration form. So I just wanted to give you a brief overview of what that tab looked like. Let's talk about what the PRAPARE form looks like if you do not use the Visualution CHC plugin. You will have spaces that will be available to you as a drop-down. You can also free text in these fields, but that includes number of people in your household, family monthly income, what is your housing situation today, and are you worried about losing your housing? Those fields will open up and allow you to populate those because you are not using that CHC plugin. Notice in addition, the migrant work and the veteran status has an open drop-down area as well. If you have filled out race, ethnicity, preferred language, and address from the patient tab on the GE side of Centricity, those are going to pull over. So that will be the patient tab on the practice management side. So this is one view of the socio-demographic, socio-economic tab without that third-party plugin. But let's take a quick look, and I'm going to show you in demo as well, the socio-demographic, socio-economic tab with the plugin installed. So if you have the plugin and you have filled out information such as at any point in the last 2 years, has season or migrant work been your family's main source of income? And what is your veteran status? Address we know is pulling over from the patient tab. Family size and family income. If those fields are filled out with that CHC plugin, that data is going to pull over onto this form. There is a drop-down here that you can still choose from. What is your housing situation today? And are you worried about losing your housing? So before I get into the next tab, which is the Money and Resources tab, Let's take a quick look at what this looks like in our demo environment. So I'm using a patient test, and I just wanted to show you one example is you could put this form anywhere in an adult visit, routine, acute. I decided to put it in an adult physical form. So as I click on this, notice these are the list of forms on the left-hand side that will show up for you in Centricity. One of the recommendations that we're thinking about is to put the PRAPARE form as maybe perhaps the third form or following the initial intake. So the medical assistant or nursing staff would take vital signs. They would do an initial intake, do their screening questions, and then it could be, one spot could be to put the PRAPARE form immediately following this. If your workflow determines that we want medical assistants and nurses asking these questions at this point in the visit, it could also be care coordinators that would be asking these types of questions as well. So you saw this on the slide, but let's move forward and talk a little bit about the note. There is a big gray button up here at the top that says remove the PRAPARE text from the note. This button, when clicked, will remove all of the information from the PRAPARE note entirely because there is some sensitive information in there, and you as the clinical staff can make the decision if you want to include it in the note or not. Notice that race, ethnicity, and preferred language is pulling over, and then because our demo environment does not use the Visualution CHC plugin, it gives me options to choose. At any point in the last 2 years, has season or migrant work been your family's main source of income? I'm going to say yes. What is our veteran status? Anything in gray in Centricity is going to be the last captured populated discrete data field. Anything in the white areas, you can drop down and answer the questions there. So notice that there is a question mark here that will pull up any definitions or give you additional information to help you answer the questions. So this is asking, what is a migratory agricultural worker and what is a seasonal agricultural worker? And that's under a specific section 330G of the Public Service Act. So feel free to click on those question marks to get additional information. And I'm just going to fill in some of the fields here. Number of people in my household, my monthly family income. Notice I can just free text type in there. What is your housing situation today? Are you worried about losing your housing? So as I answer those questions, that'll help us determine some of the next steps. Let me just click on the question marks there too. So this, oftentimes the question mark will help guide the clinical staff to say what we want to say to the patient to help them. And then there's just additional information about the definition of homelessness for UDS reporting purposes. Now, for the Centricity form, we always want to guide our eyes to the top of the page, so we go by tabs. This is the first tab here. Second tab is money and resources. Notice on the left-hand side of the screen, anything in gray with a date next to it is something I have previously answered or asked as a clinical staff, and the patient has answered on that day. So the patient has previously answered this information about highest level of education, are they employed, etc. One good thing that we could do to make documentation more efficient is we could hit the previous button and a lot of the answers would already come up. Because we previously answered it, we can still change it even though we have answered something different. So I'm no longer worried about utilities. But I want to watch the lower right-hand screen if I change my mind again and say, you know what, I am worried about utilities. There are a number of potential ICD-10 codes that we could add to the problem list. So as the patient is answering in the detailed insecurity section, we could click on this and add those items to the problem list. This would be a workflow decision. Do we want our clinical staff adding these ICD-10 codes to the active diagnosis list? This is something that your health center will have to review. And now, I had previously answered yes to all of these a couple of weeks ago, and I will go ahead and hit the drop down to answer yes as well. Notice at the bottom of each tab, there are a number of blue jump buttons. We call them jump buttons because they jump to a different form or module in Centricity if needed. So at this point, if we feel like we needed to come up with a care management plan, we could, or an enabling services where we ask additional questions, or maybe we need to talk to them about nutrition and do a nutrition assessment. Those jump buttons will appear at the bottom of the page and help navigate us to different areas that we need in addition to utilizing the PRAPARE form. Let's move on to the Psychological Assessments tab. So in the Psychological Assessments tab, notice that I had done this with this patient a couple weeks ago as well. I can either choose something in the drop-down, or if the information is the same as previous, I can click that previous button and my answers will come up. Notice that we can add this problem unspecified for a primary support group to the problem list if we need to. Also, depending on how stressed the patient is, we can do a patient stress questionnaire. So if I had no stress, notice that that patient stress questionnaire goes away. But I have quite a bit, it's coming up, and it will remain for very much as well. Let's take a look at the additional optional domains. In the past 3 months, have you spent 2 or more nights in jail, prison, or detention center? When was your release date? So we could say Monday is the example. Has lack of transportation kept you from medical appointments, work, and meetings? In the past year, have you had trouble getting any of the following when it was really needed? We said mental health care before. It also might be dental care now, and it might be health insurance. In the past year, have you had trouble paying the costs associated with health care or medicine, such as co-payments, costs for services, and costs for medicine? And I had said for healthcare costs before, but I'm also going to say for healthcare and medicine this time. And then at the bottom, it asks you additional information about, are you a refugee, your country of origin? Do you feel physically and emotionally safe where you live? And then in the past year, have you been afraid of a partner or an ex-partner? That actually, if we said no, the domestic violence questionnaire won't come up, but if we answered yes, notice that that blue jump button will come up for us to answer additional questions about domestic violence. So depending on how the patient answers, we either have potential diagnosis codes that are added to a problem list, or we have jump buttons at the bottom that appear that will assist the clinical staff in seeking some additional answers that they need. So that is the demo of the PRAPARE form and the adult visit I wanted to show you. I'm just going to go ahead and hold this document for a moment. You could also put the PRAPARE form in a care coordination visit as well. So if I click on care coordination general as one example, this might be another workflow that you choose to do. Do we want care coordination managers or case managers asking the PRAPARE questions? Our thought was if we put it in a general care coordination visit, PRAPARE could be the second form down, and then we can continue to answer these questions in socio-demographic, economic, money and resources, and psychological assets. So those are 2 areas that we think about when we think about best practice workflows in where we're putting this form. Let me just jump back into my slides, and we have covered the Money and Resources tab. One additional item I just want to point out is date of birth and patient age will always be at the top, and then at the very top of Centricity will be your patient name. We have covered everything on the Psychosocial Assessments tab. And just a quick discussion around workflow recommendations. So the workflow would be, one is the front desk staff would check in the patient. They would fill out all the required fields, both on the practice management side of Centricity And if you use Visualution on the CHC plugin tab, they would answer registration questions, race, ethnicity. They would answer the CHC tab questions. Once they fill that out, patient goes back to the MA or nurse. MA or nurse does vitals, does the initial intake, and then begins the PRAPARE form. You could put that document on hold, and the provider would come in, finish the visit, and take a look at the PRAPARE form. They will review the responses captured. If the tool does not show any needs, the patient will go straight to checkout. If there are additional needs, they can be routed to a case manager or financial counselor. Just one quick note here too, if the health center does not utilize that CHC tab, the information can be captured on that PRAPARE form, as we were demonstrating, on the EHR chart side. So with or without that plugin, we can still capture the demographic information as needed. One quick item I wanted to show you too, can we run reports on the PRAPARE form? And the answer is we can. There are observation terms, or we call them OBS terms, which are pieces of discrete data in Centricity that are embedded within the form. So as we fill out the PRAPARE form, we see new observations that are in all caps here. This is what our data staff can pull to run reports and track and trend that PRAPARE data over time. And I can show you how to do that in Centricity, really easy. If I fill this out, and because I did not sign my previous note, I'm going to just fill this part out here. I'm in the Forms view of Centricity. I'm going to the Text view, and I'm clicking Control-Shift-C, and we will see all of the questions that are related to the PRAPARE form. They're going to be in all caps. These are the OBS terms that we're going to want our reporting staff to make sure that they capture. All right, so let me just head back to my slides here. So reporting, a crystal report, now that you've identified where those OBS terms are, can be created with associated observation terms. The Alliance Chicago Clinical Data Team is currently creating a report in the data warehouse that we'll be using as a group for all of our health centers that are using PRAPARE today. I just wanted to thank you so much for your time, and please feel free to reach out to us and to NAC if you have any questions on the PRAPARE form. Thank you and have a great day.